For older New Yorkers, falls are the #1 cause of deaths due to injury and visits to the hospital and emergency room. A fall can mean the difference between walking and a wheelchair, between being sent to a nursing home or staying in one's home, or preserving independence or losing it. The hospital and emergency department charges related to falls in older adults total over $2.3 billion every year. Despite the high burden of falls, they're highly preventable. Falls are not a normal part of aging. We know what the risk factors are and how to address them. With funding from the Centers for Disease Control and Prevention, the New York State Department of Health's Older Adult Fall Prevention Program has been supporting evidence-based programs in 3 counties across the state.
The prevalence of falls in Broome County was very significant because our population here is 16% 65 and older. Our rate is about 293 per 10,000, which far exceeds the New York State rate. We did a community health assessment. Our steering committee realized that this was a serious problem for us. We got with New York State Department of Health on this, and they, through a series of discussions, decided to give us some pilot money to roll this out.
We implement programs in both the community and in healthcare settings. First, we implement 2 evidence-based Tai Chi programs. These include Tai Chi Moving for Better Balance and Tai Chi for Arthritis.
We have classes going on throughout Broome County to make sure that people have the opportunity to get these classes to help them with their balance and feeling better about themselves, easing their stress and tension.
It really has helped the coordination and just being focused on what you're doing. I hope I can continue it for a long time.
I used to could not stand an hour and do this, and now I can. It has changed my life a lot, really has. I feel like I'm not getting old anymore. I can do things that I used to be able to do.
She teaches how to hold your legs and how to walk, and I keep that in my mind, and I haven't fallen since I started.
The other community program we deliver is called Stepping On. Stepping On is a small community workshop designed for older adults who are at risk of falling, have a fear of falling, or have fallen 1 or more times. The program meets for 7 weeks and talks about a variety of prevention strategies, and guest experts are invited to talk about these topics. In the healthcare setting, we've been implementing the STEADI toolkit. STEADI stands for Stopping Elderly Accidents, Deaths, and Injuries. The goal of STEADI is to connect healthcare settings to evidence-based community programs.
When we started the Falls Prevention Program, we went to our largest hospital system and said, who would be a good champion to begin to pilot this program for us? And immediately, through our existing partnerships, they recommended Dr. Floyd.
This was truly a team effort. It took medical administration support to get this underway. It took extensive nursing involvement and development from our nurse administrators to help us devise the screening program and implement it. It took support by our electronic health record team to help us get the templates that we needed for screening into the electronic health record. After we had everything worked out here at my office, then we took it out to all the other sites in the area for them to implement.
Well, we took the information the CDC gave us out of the toolkits. We chose what we thought would work best in the offices. And after we did that, then we went site by site by site and spoke to the providers, and then we did speak to the clinical staff. So everyone was on the same page with what we were trying to roll out.
About 89% of our patients over the age of 65 have been screened for a fall risk, and we're able with our EMR to track our progress, how many patients we've screened, our care planning, and all of the different steps through the process.
We are now across 17 sites, touching potentially 11,000 patients coming through our program.
We have sent a number of patients to programs such as physical therapy, and especially to some of our community programs, Tai Chi and Stepping On. And the feedback from patients from those programs has just been tremendously positive.
It was a result of my visiting Dr. Floyd. He recommended, and he actually had a sign-up sheet there and registered me for a Tai Chi class. I've been more attentive to preventing falls, and it helped in my balance. It just makes you feel more confident to go out and actually do things.
We have already started to see benefits. Our hospitalizations have gone from 293 per 10,000 down to about 244. We also get direct feedback from the community-based organization. The participants are thrilled with this. They're committed, they enjoy it, and they feel it's really helping them.
These programs are proven to improve quality of life, preserve independence, and reduce healthcare costs. By investing in these programs, you can help older New Yorkers stay safe, stay strong, and stay independent.